to T10. We're now talking about rotation fixations in the ribs, T4 to T10. So just to remind you as to what I mean by that. Okay, can I have somebody here to assist me in the demonstration of rotation of the ribs?
Sure, so facing this way.
Facing this way. Remind me of your name?
Sarah.
Okay, Sarah, I'm going to want you to... Can you guys all see me? Okay, I'm going to want you to cross your arms. That's great. I like them at the scapula, just the way I like it. Okay, I'm going to get into a fencer stance. Now this time, instead of me being on the ipsilateral side of the spinous process, I'm going to be on the contralateral side, and my finger or my thumb is going to be contacting the non-articulating tubercle. Non-articulating tubercles of the ribs. And I'm going to rotate my patient again in towards me. And what should happen is, as I rotate my patient toward me, the ribs should start to scissor anteriorly. And because the ribs start to scissor anteriorly, I will lose a little bit of pressure from the non-articulating tubercle as it starts to slide anteriorly. Does that make sense? Okay, now there comes a point where I don't. Instead of it sliding away, it feels like it's coming into my finger here, and it also is with a little bit of discomfort.
Yeah.
So you can use the same adjusting process to adjust the non-articulating tubercle of the rib. So in Sarah's case, we've got at the level of T5, we've got a non-articulating tubercle on the left that is posterior. So the non-articulating tubercle on the left has rotated posterior. What I'm going to want to do is I'm going to want to apply a force to try to push it anterior. Let's just see what this looks like on the bony guy. So we got that. So what I'm going to do is I'm going to take my pisiform. I'm going to take my pisiform and put it on the non-articulating tubercle of the rib. Everything is going to be the same with respect to skin slack and sliding on pisiform contact here. My arm is going to go mostly straight. I'm going to cross over on the other side. And the idea is that I'm going to try to get this non-articulating tubercle back in place. Does that make sense? Okay, so Sarah, back down you go. Oh no, wait, we need this paper. Toaster.
Oh, right here.
Thank you. A little bit more than that. You can breathe. That's it. Okay, down you go. So it's on the left at T5. So I'm going to be standing ipsilateral to the lesion. The lesion in this case is the non-articulating tubercle on the left that has slid posteriorly. Okay, but I lost the spot again. I palpate, and of course when I do this, I'm palpating both sides, from all the way to the top to the bottom, all the way to the top to the bottom. I'm doing both sides. But I lost it. So I could sit her up and I could motion palpate that again and hold the spot and get her down and set up. I could do that. The other possibility is using the static palpation that I was trying to show you guys, which is if you were to cup your index fingers so that the lateral aspect of your index finger is cupping the lateral aspect of the spinous process. So we're not on top, we're on the side. And I want to be very clear that I'm on the side here. I adduct my fingers, I let my middle fingers fall down, they approximate the transverse processes. I adduct my ring fingers and let them fall down, they approximate the non-articulating tubercle of the ribs. I don't like being approximate, I like being precise. So I'm going to use body inches to see. You're going to bring your fingers together, so squeeze your fingers shut. And I'm just going to make sure that my fingers and her fingers are the same. If they were bigger, I would spread them out accordingly, and then I will be precisely on the line of the